delighted to be here with you all. My name is Priya. I am the Associate Director of Partnerships at Breakthrough US and work closely with the team at Breakthrough India. We're thrilled to be bringing you this discussion today on addressing accountability and the prioritization of eradicating gender-based violence in a post-COVID world. This is a curated conversation by Breakthrough India and also our partners at the Center for Women's Global Leadership at Rutgers University. And we have an amazing group of panelists today, and my colleague Yogita from our India team will be moderating the conversation. Thank you all for joining.
Thanks so much, Priya. I'm going to ask Krishanti to just talk a little bit about from 16 days to 365 and what CWGL is doing as a part of this initiative, how you're driving this.
Good evening, everyone, and good morning. Thank you, Breakthrough. It's wonderful to be co-hosting this very important discussion with you. We at the Center for Women's Global Leadership believe, I would say strongly believe, that a world without violence is possible. Imagine safety. No matter who you are, where you are, what time it is, or who you're with, you'll be safe. You're safe 24 hours of the day, 365 days of the year. Our bodies and minds may not know how to comprehend fear any longer, or tension or anxiety, pain or trauma. That is what we want. We want a post-COVID world built back differently. COVID-19 and gender-based violence are two deadly pandemics, and only one currently has a vaccine. The world's tolerance for COVID was not high. So the last 14 months, the world has been seeking solutions. In the meantime, women have been carrying the burden of care work. I would say 97% of the care work at home and within the home, and 70% of the frontline healthcare work globally. Yet, the world's tolerance for gender-based violence is an all-time high, and we are witnessing it now. Men inflict violence on 1.3 billion women. Male partners and family members killed 87,000 women in 2017. Male partners kill 137 women daily. That's close to roughly about 6 every hour. And from the time we start to the time we end, there will be 6 women who will lose their lives. And we all know these are only the recorded numbers. The most dangerous place for a woman is her home. And the second most dangerous place is a public space that also includes public transportation. We have a painful history and we have very painful evidence, especially coming out of South Asia and India. Violence is an indicator of gender-based inequality and discrimination. Discrimination is no accident. Gender-based discrimination is a conscious and a deliberate decision of exclusion. If we are to experience safety, then the work to eradicate gender-based violence must be linked to addressing systemic and structural discrimination that manifests in laws, global economic, financial, and labor policies, customary practices, public and private services, and the media, to name a few. We must pay attention to how GBV is reported in the media. All this work has to be done 365 days of the year. The 16 Days campaign will be amplifying its work through awareness, action, and accountability, starting now. We know that everyone does programming throughout the year, but we want to amplify this work from a campaign standpoint. We want to do this by continuing to address violence and harassment in the world of work, especially with the ratification of ILO 190 and implementation of Recommendation 206. We know the radical potential of this treaty is yet to be seen. We want to do our work by recognizing the role of unpaid, underpaid care and informal work, and working to eliminate discrimination and gender-based violence in the informal workspaces. There are 740 million informal workers. Working with women journalists to develop standards for reporting on gender-based violence and ensuring their protection when they're reporting. Working for ensuring safety and equity in public spaces, including in public transportation. And demanding accountability all year round from governments as well as from each other. There will be no building back better unless women's experiences within their multiple and intersecting identities are recognized and integrated into social, political, economic, and cultural spheres we aim to influence. The new and improved normal is not only about building back better differently, it is also about living better by valuing women's work, integrating their contributions, and recognizing their well-being as fundamental to the sustainability of people and planet. So we will be working, moving from 16 days to 365 days of the year. And we hope all of you will join us. Thank you, and over to you.
Thank you so much, Krishanti, for those amazing words. I think your description of the new normal, to use a phrase which has become in a sense synonymous with what we're going through with COVID-19, and to give it a positive tilt is something very heartening. And I hope that we're able to eventually see this new normal as described by you. My name is Yogita, and I'm from Breakthrough. I'm going to be moderating a panel with some amazing stalwarts from the feminist movement today. We're going to be discussing the long-term systemic and structural changes that are needed really to arrive at the new normal as described by Krishanti just now. CWGL, as all of you know, has really been this flag bearer in the overall global movement to prevent violence against women. And this panel really takes on from there, saying, what does it need? What will it take to really move from 16 days of activism to 365 days with commitment from stakeholders across all sorts of stakeholders? Without further ado, I'm going to introduce our very amazing panel. I'm going to start with Dr. Abiola Akiyode Afolabi. Dr. Abiola, please let me know if I pronounced that correctly. Dr. Abiola is Executive Director of Women Advocates Research and Documentation Center, also known as WARDC. She's a prominent voice of the feminist movement in Africa. She's based out of Nigeria, and she advocates for gender equality, voice, and participation of women and girls. Welcome, Ms. Dr. Abiola. We also have with us Roula. I hope I pronounced that correctly, Roula. I request you to,
To unmute myself?
Yeah. Roula is Strategic Program Coordinator at the International Domestic Workers Federation. She's based out of Lebanon, and her work is global. We also, last but not least, we have with us Priya Vardharajan, who is the lead for Gender Justice and Persons with Disabilities Cluster within the Azim Premji Philanthropic Initiatives. Welcome to all of you. Really, really looking forward to the conversation. I'm going to dive right into it and start with Dr. Abiola. Dr. Abiola, I've been reading some of your work, and you've spoken extensively about how COVID-19 has really aggravated the situation and brought about so much more violence against women. I'd really like to understand how WARDC sees their work changing going forward, and what sort of safeguards you plan to put in place, how you see safeguards being put in place that would ensure women's rights, even in situations of shock like COVID-19. Over to you, Dr. Abiola.
Thank you very much, Breakthrough India, for inviting me to this very interesting conversation. It's good that it's enough of lamentation. We need to be forward-looking in terms of where we want to see women in the coming 365 days. We need to define what new normal is to us, and our new normal, it's when we have gains based on the accountability demand that we make on daily basis, just as Christian to say for the 365 days. Coming from a country where there exists pre-existing inequality, which during COVID period and emergency period oftentimes threatens women's right generally, women's well-being, health, and also exposes us to gender-based violence. We realize that there's a lot of weakness in the architecture or the structure that the government had put in place. Most policy reforms are not gender sensitive, so they're gender blind. So during the emergency period, it becomes very difficult, for government to consider, the needs of women or gender equality issues, and that was what we saw in COVID-19. Even in terms of putting together the people that will help in terms of responding to COVID-19, gender equation was zero. There were actually only one or two women amongst almost like 30 men who were working at the national level. And you see that also goes at all the subnational levels. So meaning that in terms of policy, there is a problem. So in going forward, it becomes very important to see how the policy can change to better the lot of women, to recognize inclusion as a major issue in terms of addressing emergency. So one of the things that moving forward, it will be demanding for a more holistic policy, that will take into consideration, the needs of women in emergency. So we'll be demanding that a state government in Nigeria, there are 36 states governments in Nigeria, that the state government should have state action plan that have emergency as one of the, responding to emergency as one of the key areas in a very broad way that talks about how multi-stakeholders can respond and come up with models that can help with response. In terms of sexual and gender-based violence, we'll be asking for protocols, because we don't have protocols for police, we don't even have protocols for civil society organizations to work together in partnership to be able to respond for that. So we will be asking that state and non-state actors have established protocols that they can use in terms of responding. There are issues of women in informal sector who have been hit more than any other person during this period. So we'll be asking for government policy to respond, and to respond to the issue of women in informal sector. Then the distribution of palliative has been very lopsided. It's not transparent. It's not accountable. It's corrupt. So we will be demanding that that should be there should be open governance in such a manner that palliatives and support for women during this period are transparent and get to as many women as possible, particularly women in grassroots. Then we will also be demanding for localizing this initiative in the country.
Thank you, Dr. Abiola. That's I think there's a lot that you have on your plate right now, and a lot that you're planning. I think the fact that policy reforms are gender blind is something we're seeing across the world, and we hope to really see shifts in that. Hopefully, the 365-day campaign will help put global pressure on this across countries, because I don't think Africa is, or Nigeria in particular, is an aberrant there. Unfortunately, this is something we see across countries. I'm going to move now to Roula. And Roula, you work a lot with women in the informal sector. And a recent McKinsey report actually talked about how women's jobs were 1.8 times more vulnerable to loss as compared to men's, particularly during COVID. I'd really like to understand what your experience has been with, women working in the informal sector. Also, how do you see the Federation changing this? What is your big agenda to bring about long-term sustainable change in this?
Thank you for having me here today. The situation of domestic workers is very complex because the violence that they experience has to do with the power relations that they lie under. And these power relations often are racial, discriminatory in relation to their state of documentation, to the regularization of their work. There are a number of factors that contribute to their very peculiar vulnerability because most of them are Black, Indigenous, peasant women, rural women migrating locally and internationally for domestic work. The way the pandemic has affected the scene has also been complex. Those domestic workers who live within the confinement of the workplace, that is somebody else's private home, have had their workload increase exponentially. They're subjected to dangerous chemicals that they have to work with. And while they are expected to keep the safety and cleanliness of the household, they are also being treated as vectors of the disease because this is how racism and classism functions. You're expecting that the infection would happen throughout these racialized bodies, the same bodies that are meant to upkeep the household. Whereas the domestic workers that are live-out domestic workers and have to travel or commute to go to their employers' houses have suffered major job loss and wage theft. They have not been allowed to return to their places of employment, or they have been pushed to endure impossible conditions of work with very meager wages in order to sustain themselves somehow economically. The violence has also increased because whereas in the past, our affiliates or domestic worker unions were able to assist domestic workers escaping violent situations. Now, with the closure of many shelters and the lack of equipment within many shelters to counter the pandemic, they are overflowed and they cannot accommodate for a transitional period for domestic workers to reach safer grounds. And therefore, they find themselves in front of a non-choice of enduring a particular form of violence or finding themselves practically homeless and on the streets and very exposed to the virus. So 90% of the domestic workers in the world already do not have any social protection. And these are the numbers that are visible, that are registered, that are somehow traceable. But a lot of domestic workers also operate within informality and irregularity, making these numbers much higher. And out of 67 million domestic workers, 60 million are greatly exposed to these dangers exacerbated by the pandemic. In terms of the violence in particular, sometimes it is trivialized or sometimes it is considered to be a part of the job because of the ambiguity of the workplace. So from on one hand, the workplace is not considered to be a workplace and henceforth people cannot lobby for labor rights because of certain contexts that do not consider domestic work to be work, and therefore they cannot litigate on the basis of labor-based discrimination when violence occurs. And at the same time, it's a household, but they cannot litigate with the premise of facing domestic violence because they are not in relationships of familiality. They are not family to the people with whom they work or in whose households they exist. And this creates a very ambiguous and tricky situation for domestic workers to navigate, especially when evidence is asked for. And as we know, women are always and constantly asked to produce evidence. And evidence is something that lies in the hands of people with most power, certainly not most of the women, women from the global south, and women in the informal economy. So the federation currently is supporting our affiliates, domestic worker unions, to counter the shocks experienced by the pandemic by lifting all of the bold demands that we have had historically and still have for a fair care economy, a care economy that is both caring for those who care for us, so for domestic workers, for women taking the bulk of this labor on their shoulders, but also for governments and institutions to be able to provide certain services and protections for domestic workers and other workers of the informal economy. And today we are witnessing a discursive change whereby domestic workers are being talked about as essential workers, but we are not seeing a lot of commitment to transform this into a reality. So some of our demands, they are the ratification and implementation of C-190 because it is groundbreaking in the sense that it speaks of a world of work and not just a workplace, which is an opening for us to also push for C-189, the Domestic Workers Convention, and consider domestic work to be a job because gender-based violence and the labor violations that they face come hand in hand and therefore should be fought with sister strategies. Thank you.
Thank you so much, Roula. I think we see a similar situation in India where you have so many people, so many domestic workers in the informal sector, and we've seen similar, we've seen violence increase, we've seen the caste overtone, so there's the intersectionality of that as well. And I think it's really the perfect crisis in that sense, and really inspired to hear the work that you've spoken about right now. I'm going to move on and ask Priya. Priya, you've been working on adolescent issues for a while, and I know that the Azim Premji Philanthropic Initiatives has really been one of the biggest funders and one of the people, one of the philanthropies that has stepped forward the most during this entire COVID crisis. We've seen adolescent girls in particular suffer a lot during this crisis. They've been impacted because they've been pushed out of school. We've seen early marriage. Childline in India, for example, received 10,000 calls reporting cases of early marriage just within 3 months. I'd really like to hear how the philanthropy is seeing this. Is your strategy changing? What sort of, what sort of initiatives are you planning, and are you looking at more structural changes, or is it more from a philanthropic perspective? I'd love to hear from you on this.
Thank you so much, Yogita. Thanks a lot, Breakthrough, and everyone here. Good evening to you, and great to hear the other panelists. So at the Azim Premji Philanthropy, this is our 5th year of work, and we've been responding very actively, like you said, to the pandemic on various issues of vulnerabilities that the pandemic itself has unleashed, and the repercussions of everything that we are seeing, from health to violence to access and so on and so forth. So violence against women and girls and issues of gender justice have also been important for us, and we've tried our best to respond to needs, whether it means support of transport to women to get to a safe space, or even access to safe spaces, supporting such spaces. All of these have been things that we've been supporting through the pandemic. But beyond that, and even before we all came up, sort of started to experience the pandemic, I think the issue of gender justice has very consciously become an important area of work for us within the philanthropy. We have, for instance, sort of restructured ourselves to be able to respond to the external. So the mandate for us very clearly from the board is to do all it takes and not just all we can, you know. So that's the way in which we've approached our area of work. We have restructured ourselves, like I said, as a team itself, and we're looking a lot. So I'm just going to split my answer to what are we trying to do specifically for adolescent girls and what are we trying to do specifically for women and related issues there. So when we're looking at work with adolescent girls in Breakthrough, you are one of our very important partners for the kind of work that you do, which is very important and relevant, more so now than ever before. Our work with adolescent girls is now, not just the kind of work that we've been doing in the past, but also looking at, say, the girls as leaders, as our future leaders. So what is it? What's the, how do you equip girls to recognize and realize the inner strength and potential and actually think of themselves to be able to transform things within their local communities, become mentors? So we're very, very keen to look at programs like that. So girls in sports, girls in media and journalism, girls in governance, girls exploring sexuality, of course, trauma, mental health, all of these are also important issues that we've been looking at now and then, but we want to be spending more time on and, sort of specifically ensure programs have these inbuilt. As I speak, we've just sort of formalized our 5-year strategy on anti-trafficking, and we're really looking at certain geographies as source area, transit area, destination area, and actually see what we could do in a very cogent, planned effort to really do something at scale in the area of anti-trafficking. And we know that as we speak again, that this issue, if everything else has, had certain repercussions, then trafficking itself has, sort of spiraled in great magnitude. So these are some of the areas we're looking at. We're also thinking that, yes, we will respond to, organizations and potential partners as they come, but these are areas that we really want to specifically focus on. While these are areas of interventions or work, we're also trying to build specific focus on certain geographies, particularly around UP, Jharkhand, West Bengal. These are areas that we want to, actively scout for partnerships and see what work is happening there and actually build something better and bigger in these places. So that's as far as our work with adolescent girls is concerned. As far as our work with women is concerned, I think within the philanthropy, it's been a gradual shift, because when we started our work, we were very, looking at issues of domestic violence alone as women. And some of us have sort of anchored and championed a shift to, sort of move from domestic violence alone, or not move away, but sort of move the thinking from just women with domestic violence issues to women with, with people with gender-based violence. So that's been a complete shift. So which means that we're looking at atrocities outside of home. So like we had the first conversation around home being the most unsafe, and then public spaces and spaces outside of home, intimate partner violence, and other sort of, consent not being a part of conversation. So how do we build that? Atrocities against Dalit women and people, then violence and lack of identity and issues around identity of gender minorities, sexual minorities. So all of this has also become a very, very integral part. So we're structured as a team to be able to work on these areas. Again, mental health becomes a very important, critical part of this whole narrative. We're also looking at issues of, we spoke about domestic workers. I am personally invested over the last year and a half looking at garment factory workers. So particularly the belt of Tamil Nadu and Bangalore, Tumkur, that area, which actually forms about 40% of the exports of garments from India. So the sort of violence that the women suffer, marginalization, lack of any other opportunity, how do the children and families in those households get impacted? So even through COVID relief, but beyond that as well, ensuring that children and adolescents don't get into garment factory work, but actually have an access to education and childhood and everything that they have a right to. We're looking at causal linkages. So how do you actually engage in work with men, particularly the batterers, and not just work with men and, not just work with boys or adolescent boys, but actually look at men who are the cause for violence. looking to see how we could build. We have a few very good organizations working on the legal side. So how do we actually help them scale and have barefoot lawyers and other sort of community-based lawyers, so that the legal side is more, women and people who suffer violence actually understand the law and actually get some next steps logically towards access to their rights and justice. So there are many such programs. Again, here we are looking at geography, we're looking at UP, we're looking at Maharashtra for various reasons to be able to build some stronger programs. Then we also have our largest number of partnerships, incidentally, in Maharashtra. So so some of these areas are things that we've been doing. Many are what we want to learn from our partners and see how we can actually take this forward. I hope that sort of covers what you wanted to ask me, Yogita.
Thanks so much, Priya. That's a huge gamut that you're kind of looking at, starting from adolescent girls, looking at violence against women, looking at legal recourse, looking at structural recourse. So fascinating. And I'm going to come back and, pick up the conversation from here. We've actually been joined by Bama. Athreya, welcome, Bama. Just a quick introduction. Bama is Senior Advisor on Gender Equity and Inclusion at the Laudes Foundation. She comes to us with 20 years of experience in international labor, gender, and inclusion. Welcome, Bama. It's lovely to have you here. Bama had a question for you. So as you know, women make up 39% of global employment, but they also account, unfortunately, for 54% of overall job loss. In India, as I think all of us know, the women's labor force participation rate is down to an all-time low of 20%, and this was even before COVID hit us. What, therefore, is the Laudes Foundation really looking at as a way forward? What are the priorities that you're looking at, and what's your, in a sense, post-COVID strategy looking like on the issue?
Thank you so much, and it's such a pleasure to join you all today. Really appreciate the invitation. So this year, Laudes Foundation has really had to do an immediate reaction, as many in the philanthropic space have done. So speaking as, kind of the representative of the philanthropic community on this session today, one of the things we had to look at is what is our role, and our role really is to support the resilience of the groups that are doing the frontline work. And in our case, because we had already been committed to gender equity as an integral part of the work we were doing, we really sought to just say, look, in our immediate pivot to emergency response for, again, those groups on the front lines, the grassroots groups, the groups that were already working with women workers in factories, what more can we do to ensure that the groups themselves can, just sort of survive this crisis? Because in terms of reaching and ensuring an equitable post-COVID response, it's up to them. And it's you, right? I mean, it's really up to you, because those on the call are among our partners. And so that was really our approach this year, was to say, we know that there will be gender differentiated disparate response in terms of things like layoffs, as you've just indicated, in terms of the increase in unpaid care work, in terms of the access to health, right? So all of these things are interlinked, and we need a strategic response. And it's just yet another illustration of why it's so important to have a gender lens across all the work that you do. In terms of specifics with emergency response, a couple of things that I'll highlight this year. One is that we, in the context of saying how can we reach more grassroots groups that actually are in need right now, and particularly feminist perspective groups, we partnered with Global Fund for Women. Through them, we are supporting 3 regional women's funds. And that work, we're really glad we were able to, again, shift some funding this year to say, let's just, really make sure we infuse resources to groups that are able to continue that frontline advocacy work, as well as obviously service delivery. So that was one. And then the other, so pleased to be on this webinar with our wonderful colleague Krishanti and Center for Women's Global Leadership. And our investment there was to say, look, we are not the ones who are going to determine what the strategic response post-COVID should be. We want to empower and then learn from the experts whose voices, frankly, have been marginalized for all too long.
Thanks so much, Bama. We'll in the Q&A later, I'd like to talk a little bit more about long-term views and strategies, but in the interest of time, I'm going to move on. But thank you so much for that. I'd like to pull in Dr. Abiola again. Dr. Abiola, as you know, there are still 48 countries in the world that don't have laws that prevent domestic violence. There are also 29 countries that don't ensure property rights to women. So how do you at WARDC really believe that we can hold governments accountable to the SDGs, as well as to just ensuring human rights for women on an equal footing? Also, I'd love to hear, any examples that you might have where you've seen successes.
Well, thank you very much. I think that one of the first things that is important is to first build a very strong women's network or women's movement in country, so that we can then come together to make demands of the government. We need to first organize, because when we organize, we can make demands in a manner that they will know that we have a strong force. We're a strong force together. Of recent, there's what we call the end SARS in Nigeria. SARS happens to be the police, and the police had been very brutal to people, very unfair to people, and feminist organization, women came together, to mobilize people, to begin a campaign, to end this oppressive rule of the police in Nigeria. And that movement led to one of the biggest movements, that we have. And the feminist group made like 5 points demand for the government. And the government had no option than, to listen, to the demands put by this group. And the reason is because they were able to build a movement with the same purpose, who were able to insist on what the government needs to do to be able to end the oppression of the police. And also of recent, during the COVID period, women organizations in Nigeria also came together to insist that the government must demonstrate political will by declaring a state of emergency on sexual and gender-based violence. And the government of Nigeria, through the Governors Forum, had to commit to that, as a negotiation to be able to deal with the issue of gender-based violence in Nigeria. So as of today, there are conversations which we have never had before at the national level, discussing about sexual and gender-based violence. Within the period of COVID March and now, about 6 states in Nigeria had come up with state action plan. About 4 states have come up with laws, and policy, addressing violence against persons after they had declared state of emergency. And as we're speaking at the national level, they are working on ensuring that there's gender budget, because they have also realized that funding, to support response for women is one of the major reasons why responding to domestic violence or violence against women is not working. So they're also working on the issue. So women organizations must come together as a movement, in country, then build alliance across country to make demand for government to demonstrate political will towards the achievement of SDG 5, to also insist that resource must also be a top priority, for the government to be able to put forward gender equality aspiration for the world.
Thank you, Abiola. I think lots of lessons for us across the globe in, fight to ensure adequate resourcing for the reforms we look at. And also, I love the point on organize, because I think often we don't collaborate enough and we don't come together in as strong a force as we should. So really, I think a lot of insights for us there. I'd like to move on. Roula, I'd love to ask you of success stories that you could share with us from your work with the Federation. I think it's relevant to all of us on the panel, and a lot of the attendees. It'd be interesting to hear some of the examples you have.
Absolutely. A lot of what has been said completely resonates with our sector, and this is because it's not confined within the sector. It's a much broader public interest cause that we need to be rallying around. Some of the most successful work that has been done by our affiliates, domestic worker unions, and by the Federation itself, um, some of it has to do with labor rights. For example, in Paraguay, at the time we were doing a rapid assessment for the protection of domestic workers from gender-based violence. They have gained the minimum wage. They have made that a legal move towards accessing 100% of the minimum wage, which means they would have some economic autonomy in order to escape abusive households or to be able to have some time in order to change jobs. So labor rights. Labor rights are very important in the sense, and so are other areas of work and other movements, including the feminist movement that we have collaborated with and continue to seek venues for alliance building and broadening our base. For example, in Hong Kong, something that has helped greatly domestic workers is the Disability Act that prevents employers from firing domestic workers or employees in general if they contract the virus or if they display any symptoms associated with COVID-19, which for us means that there is a space for co-organizing with different ability and disability movements, in the sense that manual labor and feminized labor at times that is considered disposable if it is not able-bodied, and this is something that we need to be working on collectively and not only sectorally. Another small victory that we're able to see within particular contexts is urban movements or urban planning movements coming together with domestic worker movements and thinking of fair housing, working against the eviction of domestic workers from their households, working against the gentrification. And this is because these bold demands that we used to lift in the past are not mere surrealist, idealist claims into a brighter future, but they're very much relevant to the reasons why the economy is breaking up today and why this global pandemic was able to disrupt a lot of the normalcy that we have been living. We're also working with feminist movements on a reproductive justice perspective. Some of the challenges that domestic workers encounter is that they are denied the ownership over their own bodies. They are denied motherhood, or they are forced into it. It depends on the context, really. So a lot of the contractual arrangements forbid them from having that sort of economy. So we cannot envision a world free of gender-based violence without thinking of the reproductive justice framework as it relates to particular fields of employment. And also when we think against hostile migration policies. For example, the Global Compact on Migration was adopted 2 years ago. That is that didn't happen during the pandemic, but still that has enabled us today to push for certain demands, in particular for the migrant domestic workers that are stuck in borderlands without firewalls and that cannot report to hospitals, governmental hospitals, because they are not regular workers and they are afraid that this would put them on the radar of hostile governments with hostile policies. And therefore we have to have, similarly to the 365 days round campaigning against gender-based violence, we also have to have a 360 angle view on everything that the domestic workers are encountering. I'll also mention a few small steps towards progress in different contexts. In Qatar, domestic workers are under the kafala system, which is a visa tied to the employer arrangement that puts all of the authority within the hands of the employer and exists outside of a legal system, national or international. So recently, Qatar has made a step forward by allowing domestic workers to break up the contract with their employer. This was not allowable in the past. And this means a fracture in a system that has been historically discriminating against domestic workers and the potential for change for the system in the Middle East. Another victory also is on an organizational level with our affiliates. So the unionizing, organizing aspect of it. Countries that have more civil liberties and freedoms of association have also been able to protect the informal workers much better. We have affiliates who are conducting referral systems and casework management and are able to assist their colleagues within these difficult situations, which would not be possible without a hosting environment for that.
Thank you. I love that concept of the 360-degree view, and I think it's valid not just in the case of looking at domestic workers or looking at people in the informal sector, but it's something we have to keep in mind across everything that we do. Thank you. That was a fabulous response. Bama, I'd like to, I was reading this recent OECD report, and one of the questions I really had was, the trend so far has been that, philanthropies by and large, global philanthropy has really not given a lot of priority to gender equality. And within gender equality, violence against women is less than 1% of overall funding. How do you think we can shift the needle on this? How can we make it more of a priority? When you think about the numbers are, they're overwhelming. 35% of women globally have faced some form of violence. 70% have, been sexually harassed. When the numbers are that large, why is it just 1% of funding, and what do we do to kind of shift that needle?
Yeah, thanks so much for that. It is absolutely something that we need to be addressing in global systems and structures and including in international instruments. And some of the good news, of course, in the past year, a little over a year, is that we have seen some quite significant shifts in attention at that global multilateral level. And I think that sets the groundwork for doing what we need to do now in terms of increasing those investments. Recognizing, as I'm sure you all have already mentioned and discussed, the ratification of the passage and now the need for country ratification of the new ILO instrument on violence at work. That was huge. If you look carefully at that instrument, of course, it covers a lot more than just the formal wage employment. It is really about violence in the world of work, and that is a critical instrument that we can build upon, and something that we have been supporting advocates to build upon. So that's one piece. The other thing I will point out is, one of the ironies, and since you referred to OECD, is that a lot of the other assistance is not fully safe or appropriately safeguarded. And so another positive development over the past year was that, we finally saw really a beefing up of guidance and including a very good document from OECD that is providing better global guidance on preventing sexual misconduct and abuse, so that at least, that too is another way of sharing, sort of putting a spotlight on the fact that we need to invest in ending violence against women. We need to do it because none of the other work we're doing can be safe for women unless we are also doing that.
Yeah, absolutely. And I think Krishanti's work is so it's monumental in really highlighting the issue. And I think more of us need to rally around the kind of work she does. Priya, moving on to you. In the Indian scenario, one hasn't seen too many philanthropies come together to really focus on gender. We were on a panel together a couple of months ago where we actually asked philanthropists that, what is it about, what do you think about investing in gender equality? And there was this silence. So I'd love to hear from you on what we could do to actually, work together and also demand accountability, not just from philanthropists, because that's really just one of the stakeholders, but really look at the whole system. How do you push for government accountability? How do you work with civil society collaboratively? How do you create, how do you galvanize this movement in a collaborative manner?
I'm going to be candid, and I would have said, please don't quote me, but it's anyway streaming live on Facebook. But I think it's a very, very critical question, and now more than ever. So basically, if you're looking at, say, the philanthropy web that I work for, I think issues of adolescent girls, like I already said, is very, very important. And we've had a commit of about 300 crores so far in the last 5 years just on adolescent girls issues. And on gender-based violence is about 40-50 crores. And these are 3-year grants. But unfortunately, that's not enough. And like you already started saying, and like the other panelists have also been reiterating, it's just completely underfunded, right? Gender-based violence, and particularly human rights and gender justice, more than anything else. And what really bothers me is that funding goes for something very loosely called women empowerment, and nobody knows what it really means. And it's just some sort of a tokenism. And now with FCRA and the CSR and lack of political will, it's just a lot of frills that get supported and nothing from a real rights-based angle, which is honestly to be supported. And in some sense, I feel when we're talking about programs building awareness here and there and with communities and people, I think there needs to be an awareness within the donor world as well. And it's important for perhaps civil society to build that awareness within, funders, that gender-based violence or violence against women, girls programs are not straightforward programs where you do something and then you get something. It's going to be a very long journey, and that sort of patience is required. You're not going to get anything out of it except the fact that you have supported something that does not get supported, and it means something for the person at the end of that entire chain, right? And that's the feeling with which you support. And what does prevention mean? Because many times one does not get it to say that that this is a case of domestic violence and we're working on a prevention program. And then the question is like, but she's already been either violated or she suffered violence. But what does it really mean in a feminist narrative is something that people don't get, and that's something that needs to be understood, because otherwise we're talking about programs where everyone is looking to see someone who's completely beaten and bruised, and so you're not looking at it from a complete sort of let's prevent this, let's inform, let's support and show the way kind of thing, because that's not something that's understood clearly. Also, what do you get in 3 years? These are not programs where you should put some targets and numbers at the end of 3 years, because they're long-term sort of behavior and thinking shift. And so once this shift happens, perhaps that silence that you were talking about, Yogita, may actually start with murmurs. So we are very keen, and personally, I'm very, very keen. And I've also started this in my own way. In fact, just yesterday, so while I'm working on gender-based violence and violence against women, and I'm seeing the reception or receptiveness there, we came together as a group of funders yesterday for disabilities and mental health, and the reception was very different there, and I'm quite bothered seeing this in some sense. But I feel that it is very, very important for donors to come together to understand what are the areas to be funded, where is the need, actually, which parts of these programs are never getting funded, what are the funding norms, because each donor comes with a certain list of criteria, like we have some criteria in APPI. So similarly, funders have these criteria. So what are those, and how can we actually sort of understand each other better so that we ensure there's continuity of a program? Because we go back to the organization and say, oh, you're just working on a project mode, but you've not funded beyond that, right? So how do we actually sort of answer our own questions and not ask those ridiculous questions many times? How do we support interventions for a long period of time? Like I know funders like Paul Hamlin look at funding from like 0 to 7 years, and we at the philanthropy look at programs that have already had some sense of work on the ground. So how do we actually work with such funders to say, okay, you're supporting for the first 7 years of the program, now we'll take over, so that there is a continuity, because that's when you know that when you're talking about, say, causal linkage and working with men and actually seeing shift in their behavior and thinking, and then attitude and then action and everything, we need to be invested, right? And it can't be a 3-year period. And period, right? So that's important. Someone has to fund pilots. Everyone can't say that we'll work on it after everything works on the ground. So who's going to do that funding, and how do you engage and understand this? So informally meeting and working together as donors is very critical. So that's to answer one part of your question. Perhaps I took a lot of time, but it's my honest to heart, from heart kind of answer. Working with government or influencing government is going to be a very tricky thing, I think, as donors. And I don't know how many of us would be willing to walk that way, particularly because many of the areas of work we're talking about are justice and human rights and that perspective. And so as donors, maybe we would also want to be careful and not antagonize government at a time when, you know, the Indian context is the way it is. And we want to continue work and actually support more and more organizations in multiple areas as well. So that could be something. And when I'm saying we, are not talking just from Azim Premji Philanthropic. I'm just sort of taking the liberty to talk from a donor world, because I was talking to another donor yesterday with similar sort of things. So we'll have to really see how we call those programs or how we call those areas perhaps, and continue to push and, you know, support the organization so the effort of the movement does not come to a close. And I'm talking about the entire sort of women's movement and everything that is, you know, activism today, where it continues and continues to be productive, but at the same time may not be there right up in front holding those placards and saying, come, let's push and get the government to move. But we are invested, and I think we should be a little more vocal with civil society and say that we are invested and do that in action as well. Yeah, thank you.
Thank you for that candid response, Priya. I also think that, you know, I think the point you made about patience and really walking the long journey together is a really valuable one. And it's something that we really need to dwell on. And also not being confrontational, but actually taking people along. So that's really valuable. Thank you. We have a couple of questions. Bama, there's a question for you asking what the OECD guidelines against GBV were, the ones you were talking about. So just quickly, we don't have too much time, so just quickly picking up a few of the questions.
Sure, that's a pretty obvious one, and I think it's easily available on the OECD's website. In response to a number of incidents around the world, and some very high profile of sexual abuse by aid workers, by people who were, you know, doing service delivery in critical contexts with vulnerable people. You know, you had a number of incidents. You had a global response, and you had the development of a set of guidelines that are, you know, precisely on preventing sexual abuse. So that's what that is. I think it's a positive development because it was really something that was across the donor community, a recognition that we are doing harm because we are not preventing gender-based violence in the context of all of the other work we may be doing.
Thank you. There's also another question saying, is education of adult women a strong focus area of any of the panelists? Roula, if you can speak to that, or anybody else who'd like to take that question.
Part of the work that we do involves worker education, so it would be considered education of adult women, but it is done from a locally driven perspective. So this is not something that the Federation brings in top down, rather it is knowledge that is created in conversation. And like has been mentioned in this panel already, a lot of these voices are historically invisibilized, and this knowledge is considered unworthy of knowing. So the place where we come in is making the linkages with the instruments and making information accessible, working on language justice, because sometimes that is the issue that prevents a big part of the accessibility of adult women, specifically when they enter the field of informality because of the lack of other economic opportunity, which means that like the lack of schooling as well, because then they would have to prioritize which member of the family would acquire that particular education, and they are often the ones to pay for that education due to their domestic work. So it's mostly about making the linkages and working on language justice, accessibility, and paying credit where it's due. So locally driven perspectives.
Thank you, Rana. We don't have a lot of time. I'm just going to ask everybody like a quick, like 1 minute answer, starting with Dr. Abiola and also Krishanti. I'd like you to just give your one-line answer to this. What are you most hopeful about right now? What are you most positive and hopeful about? Start with you, Krishanti.
I'm most hopeful about women and women's role in shaping the world. I think it's really important to recognize women's agency and that we have the right to an inherent dignity. That means that we know how to make decisions for our lives, our families, our communities, and the world. Thank you.
Thank you for that, Krishanti. Dr. Abiola?
I'm hopeful that women would continue to work together. We will use our local indigenous knowledge to shape the world. I know that we have that ability to mobilize, and to also make change possible, transformative change indeed. So I am hopeful that we will use all that ability that we have and our capability as women, to push forward this issue that is seen as our own new normal to change the world, to make the world a better place.
I love that new normal phrase. Priya?
I think I'm very positive or hopeful about civil society coming together, particularly organizations who come from a very feminist way of thinking and working on the ground. I think it's time that we come together and work on something that, sort of adds more meaning and also helps in scale as much. So I'm very optimistic about civil society and the ability to dissent as well as come together and do things together.
Thank you. That's inspiring and really something that I'm also personally very hopeful about. Bama, I'd love to hear from you.
I'm hopeful that there's a visibility to these issues that is beyond what we have had before, and I think we are no longer just shouting in the dark. We are being heard. We are being taken seriously in the highest of policy venues, and that creates an opportunity for a really seismic shift in the nature of how we address gender equity and gender-based violence. But for that to be achieved, now is the time to really reinforce each other's voices. That movement building, the social movements have never been more important. And I think every single person that is joining us today on this webinar, please raise your voice. We need to be a very powerful echo chamber for each other in the coming months.
Thank you, Bama. Roula, over to you.
It is so difficult to speak after Bama, but I will try. So I am hopeful because what we're witnessing today makes our labor and our dignity indisputable, in the sense that all of the work that is put out there relies on the work that we put in here in our private households, whether in paid relationships or unpaid relationships. And this involves production and reproduction in both of the sense of these words. So I feel that our plights are indisputable, and I am hopeful about unionizing and also about transnational organizing to broaden our base and to make these struggles that we're facing not dismissible on the level of their relativism or by some kind of cultural arguments, rather get them back to the economic underpinnings and the underpinnings of the three biggest systems that we struggle under. So patriarchy, racial capitalism, and ableism.
Thanks, Roula. I've had a really great time chatting with you. I wish we could go on a little bit longer. I've been super inspired by all of you. I'm going to hand over to Priya for a few last words, but thank you so much for joining us. It was a real pleasure. Priya? Yeah.
Thank you, Yogita. It's been So meaningful to be here as a fly on the wall in this conversation. Thank you all for your insights, for connecting this issue to so many systemic forms of oppression and looking at it through a transnational organizing lens, as you said, Roula. I want to echo what Krishanti said at the beginning about the 16 Days campaign being about awareness, action, and accountability, and about translating that into awareness, action, and accountability 365 days of the year, and doing it in such a way that uplifts people and that really centers those who have been increasingly marginalized in the COVID-19 pandemic, looking at care work, looking at the labor force participation of women, looking at so many dimensions of this crisis and accelerating our outputs, and also to your point, Bama, about the role of the philanthropic community in supporting frontline organizers and those who are really building the resilience of activists and ordinary people who are struggling with the pandemic of gender-based violence. So I think it's been a very rich conversation. It's been fascinating to hear perspectives from Lebanon, from Nigeria, from India, and globally. And we look forward to continuing the conversation and to being activists together, movement builders together, and hopefully moving toward that brighter future, the one where we all live in safety and where we are sisters in solidarity across communities. So thank you so much, and look forward to continuing to work together.